Hi, my name is Charissa Fotinos, and I'm the Deputy Chief Medical Officer for the Healthcare Authority. This topic is one that I am both interested in and find very important in terms of healthcare delivery, and that's talking about evidence. How do we use evidence? How do we get it into play so that providers can have it at the point of care? And what role does evidence play in terms of value? We talk a lot about value in terms of cost, but if we're not providing good quality along with controlling cost, we sort of lost the biggest piece of value in my mind. So what tools are out there that providers can use or support staff can use to help assure that the care we're delivering is in fact that which is evidence-based and appropriate? There's a sea of tools out there, whether it's guidelines that are vetted in small groups, guidelines that are vetted at the national level, or international guidelines. There are guidelines out there how to do everything. And we know certainly that there are the best ways to take care of some common conditions. We know what we're supposed to do for diabetes as primary care providers and specialists. I think we can pretty much agree on goals for hypertension treatment. So there are some things that really don't need that much variation in terms of how to care for them. Are we providing our providers in our clinics or our healthcare systems with that information so they don't have to vary amongst themselves and figure out or use an outdated way in which to care for people? If we think about the importance of getting providers the right information, we can think back to some of the things that we knew from the literature were appropriate or not appropriate to do that it took 5 or 10 years to act on, or things that were put into place before we really knew the safety effects, lidocaine for cardiac dysrhythmias after a heart attack, for instance. It took a long time for things to get adopted that weren't necessary and were actually harmful. So how can we assure that the providers who are seeing patients every day have that information at the time they're seeing that patient when they need it? There is plenty of room in medicine for variation. That's because every person that a provider sees is different. Their circumstances are different, how they manage and deal with their lives are different. But what really doesn't change from person to person necessarily is you use a beta blocker for someone who has high blood pressure or an ACE inhibitor. So some things that we do are not that different from patient to patient. So how do we help providers understand where variation makes sense and where best practice or evidence-informed practice should be done? So as part of this discussion, I hope that you explore a couple of the following themes. How do providers get evidence? Is that something that they're left to on their own, or is that something that's the responsibility of the health system, or the state for that matter, to help provide for them? How are we checking to see that the best evidence and the best care is being provided, both in terms of outcome, but also in terms of unnecessary testing and not doing things that we know don't really help, but might be habit from years of practicing one way? So how do the systems help providers get the information they need to provide good quality care that is evidence-informed? Do we decide as a larger system and state that there are certain guidelines that we can all agree to? There are hundreds out there. Why do we have to have 100 different ones? Can we or should we decide that there is a set of guidelines we're going to adopt as a state for the care of basic common illnesses? Maybe not, but I think it's worth a discussion. Really, at the end of the day, how can we get people the information they need to provide the value that each patient client deserves? And that's not just in terms of ordering the right test or prescribing the right drug, but it's being able to give the provider the tools so they can actually have the time to talk to the patient. Because at the end of the day, that's really what a lot of us went into medicine for, was for those personal relationships and to have the ability to spend time with our patients, understanding that each one is unique. Their diseases may not be, but how they manage them and how they deal with them indeed are. And then for a future think, how do we get patients involved in them understanding evidence and them being good consumers of what they're trying to get from their healthcare provider, understand it, and when they're offered something that doesn't really show that it's evidence-informed, help them understand to say, no, I really don't want that, I'm not sure that's what I need. That's future vision, but for now, what can we do to help assure that the care we give is indeed value-based, not just from a cost perspective, but from an evidence-informed one?